Hello, good morning for joining us today. This is Dr. Doni TV. What we get to tell now today now cervical cancer. On I know say after breast cancer, cervical cancer now one of those cancers when we say it did too much for the world. On I know Abi. And on I know say this thing, the major problem when this thing they cause now for most of us when we say when them born our young girls are down within that age of 9 to 12 years, say they know they give them this HPV vaccine. On I know say now waiting they make them for future, they get cervical cancer. Now I want to tell you today that it's very, very advisable for us. Say when you born woman today, within the age of 9 to 12, try as much as possible to give them this HPV vaccine. Very, very important. No fear. No say you no go give them because this thing have been done in the Western world, synthetic form and other thing. But I want to tell you that the advantage of giving that HPV vaccine, it could pass the disadvantage when the problem of this cancer will come cause for future. So my brother, well, there has been said that yes, there is a preventable stage even to the age of 26. One can also take it, most especially for those ones when we say they no take them when they within that 9 years to 12 years. Okay, now, open and no say people when they get this kind of things, they get some kind of things when their body they tell them, and there are a lot of risks, most especially women when we say then they within the age of 35 to 65, this thing they common to them. And again, even women when we say then they below this 35 years, these things also they affect them, most especially if there is underground immunosuppression disease like HIV and so on. This thing will they disturb them. And again, there are a lot of things. How about family history? How about people when we say they don't get plenty children, they are prone to having cervical cancer. Why? Because their cervix and all those things have been prone to a lot of, infections and so on. How about we will say they never reach the age to start to they make love, they can't they make love. Say all these things now factor when we say if you make people to go get cervical cancer for future. Now, when they don't get these things, so when women don't get these things, it gets some signs when they follow them, such as postcoital bleeding. When we say they just meet man small, next thing they don't they bleed. In between their menses, maybe their menses they start 12. The next one when supposed come 12 next month. In between them, their menses never reach. They can't they bleed. What they call intermenstrual bleeding. Do you know? All these things are signs. How about weight loss? Most of them you go see them. Their clothes not they feed them again. They will come they lose weight so much. So they will come they ask, waiting they happen. I don't get this sickness. I don't get this sickness. They don't know say yes, maybe now cervical cancer they disturb them. How about them looking so ill looking? They can't eat, they are weak. Sometimes most of them they've lost blood. They don't know that it's cervical cancer that is disturbing them. So my sister, I want to tell you that it is very important for you to do a pap smear. Most especially when you don't reach 26 years or from 20 or 18 years safe. It could make you they do pap smear. You go come hospital, your gynecologist go put one probe for your cervix, collect and put her inside container, then go send them for histology, cytology. Then they will come show, see whether the cells when they did there, whether it they overgrow or they grow. Because the problem when cervical cancer, so you won't get your picking, so make sure say you try to vaccinate them at that early age, so to prevent this thing. And again, that pap smear too, they very important. We almost endeavor to do pap smear for our children. Okay, vaccinate them when they are 18, 19, 20. Make sure you start telling them to do a pap smear. Thank you. Keep subscribing to Doni TV. We love you. Bye.